Welcome. I'm Dr. Pearl Werfel, and this program is designed to give you some stress management and coping skills. So, just a little bit about me. You can see on the screen I have a lot of experience with MS. I'm a psychologist in private practice in San Francisco, and I have been working with people with MS for many years. I am also a person living with MS. So I won't bore you with all the details, but if you'd like to see my experience, you can certainly read the screen. So let's talk about why we're doing this program. We want to give you some tools to understand about stress and anxiety, how stress affects the body, the relationship between stress and pain, some things about coping, and then the most important is stress busters and mind-body interventions. So I'll be talking for a while, and then you'll have an opportunity to join me in some experiential activities. So let's start talking about stress. Many of you have heard a lot about stress, as there's been so much information out there about stress and MS. But I'm just going to do a little review for people that maybe don't have all of the information. So stressors are those situations that increase our stress. Anything that poses a challenge or a threat to our well-being is a stressor. And stressors can be physical or psychological. Now, certainly the current stressors that the COVID-19 outbreak have brought may be unavoidable. And so you may be experiencing more stress than usual. But even with this, you can learn to lessen the impact on your life. So let's talk about what happens in the body when we experience stress. And many of you will recognize this. Psychological stress can cause physical distress. The body has a hard time telling the difference between a psychological stressor and a threat to the body. So stress can trigger that body's response to a perceived threat or danger, which is called the fight or flight response. And when your body goes into fight-flight mode, your body is preparing to either get away or fight. The fight-flight mode is there to protect us from impending physical assaults, like running away from something really scary or having to fight. But our body reads a stressor that's caused by a thought like the same as a threat by a tiger. You know that when you're watching a scary movie, you may know that you are in your own house. But if someone walks in the room when you are watching that movie, you may jolt or you may tense up, even though you know you're just watching a movie. It's because what's in our mind affects our body. So the body begins transferring as much of its resources as possible to enable you to deal with the perceived threat. And this is when inflammation occurs. So what happens? Blood pressure can rise, breathing can become more rapid. You've experienced this before. Digestive system may slow down, so your stomach starts to bother you. The heart rate can rise. And we've all experienced either the shoulders going up to your ears or the teeth being clenched or the jaw being tight or the chest getting tight. So let's talk a little bit about stress and MS. Stress can't be avoided, especially now. So managing it is one way to live better with MS. During stressful times like now, it's quite normal to feel stress. But poorly managed stress can lead to increased fatigue, balance difficulties, sleep and eating disturbance and elimination, difficulty thinking, and increased pain and discomfort. And since so many of these are symptoms of MS anyway, we can understand again why it's so important to manage stress. The good news is well-managed stress can increase our wellness, energy, and physical comfort. So now that we've talked about stress, I want to give you a minute or two or three to see one way that we can help you with stress. So take a look at this picture. If you like it, continue to look at it. If water bothers you or you don't like the picture, I welcome you to close your eyes or look at something nice wherever you are. And this is just nice and easy Just breathing, not having to breathe in any special way, but I want to invite you to check in with your body just a little bit and notice if there's any stress that's come when I was talking about stress. So check in and see, maybe the jaw might be clenched. You might want to open your mouth a bit, or your shoulders may have moved up or tightened or gone forward, and you might want to take a breath and move them back. This is just inviting you to pay light attention to what's happening, not to fix everything, but to allow yourself to breathe. See where you're seated, or maybe you're lying down, and shift to see if you can become more comfortable. And see if you can, focusing on your breathing, just quiet your mind a bit. And no, we're just talking about stress. And in talking about it, your body may have reacted to it. And now we invite, in any way you would like, to just breathe and tell your body there's nothing to do and nowhere to go right now. Just breathing and listening. That's all you have to do, is just breathing and listening. And that's a breath in and a breath out, to just be breathing and listening. Very simple, very short and simple, easy ways for you to disengage that fight or flight that may occur by just taking a moment at any time and readjusting where you are, breathing, and giving your body permission just to feel a little more comfortable by lowering shoulders or opening your mouth, or whatever might happen that you can do so that you can feel a little more comfortable. So that's just one of many techniques that you can use, and we will move on, but I want to invite you, at any time you start feeling that tension again, just allow yourself to stop and tell yourself you have nothing to do except listen, and nowhere to go except right now being here. So we'll move on now. So yes, people got relaxed, and of course I'm going to talk about anxiety. So if even seeing the word anxiety brings some stress again, I invite you, make yourself comfortable as you can again. So anxiety is characterized by what we call excessive worry, feeling really wound up, tense, or restless, with difficulty controlling thoughts and feelings. Most people can be anxious about something from time to time, but it's how you're able to cope with anxiety that makes all of the difference. So, like stress, it's about your ability to deal with the anxiety that comes up. So, right now, in where we are now, anxiety is a very normal response to a pandemic. And it doesn't mean that you have a disorder. There's a big difference between anxiety and an anxiety disorder. And it's marked by duration, the time it's lasted, and its intensity. So some questions to ask yourself: is it taking over your life? Or can you put it aside sometimes? Only a qualified professional can really make the diagnosis of an anxiety disorder, but you know yourself if your life is being controlled or if you have control. And if you're feeling like the anxiety of this moment in time or in your life, is overwhelming you and you can't put it aside, that's time to think about seeking some help. So let's talk about managing what you can do to manage stress and anxiety. Really good news, as we talked about, that psychological factors and beliefs can affect how our body feels. But beliefs about symptoms and coping styles have been found to play a really important role in a person's ability to live well with any chronic illness, and that includes MS or disability. As research has shown, the better your coping and stress management skills are, the more physically comfortable you will be. So some stress busters, deep breathing and relaxation. We were doing a little bit of that just before. Imagery, which we'll do later, thought awareness and reframing, meditation, psychotherapy and self-help groups, and self-care such as exercise or movement, sleep, engaging in enjoyable activities, and understanding what's going on. And there's some more. Here's a whole list of them: taking some deep breaths, taking breaks, low stress hobbies, and right now, minimizing the time watching or reading the news is a really good stress reducer. And there's even more. Listening to music, having a good sense of humor, talking to a supportive person, spirituality and prayer, and you may even be able to add to this list. All of these things that have been listed are all stress reducers. And let's not forget the all-powerful smile. Even when we smile, it reduces our stress just a little bit. So I mentioned coping before, and we're going to talk about the good and bad of coping strategies. There are three main types of coping strategies I'm going to be talking about. One is avoidant, which means coping by taking your mind off of the stressor. Another is instrumental, coping by finding a solution, or psychological, coping by honoring your feelings and getting support. These coping strategies can be helpful or potentially harmful. So let's go through them and take a look at that. Avoidant coping. Helpful avoidance relaxes or rejuvenates you. And certainly now, so many people have been talking about books people are reading or movies people are watching. Really helpful. Playing with a pet, looking outside or going outside to see something beautiful, learning something new, playing a game. All of this is helpful avoidance. And it's helpful if it relaxes or rejuvenates you. If after you've done it, you feel better, and if it takes your mind off of something that's troubling you. Here's when avoidance isn't helpful. When you need to do something, you need to take action, and you're not doing it because you're avoiding it. Like being an ostrich with your head in the sand and the rest of you exposed and vulnerable. If you're spending most of your day with entertainment that just zones you out, but it doesn't really help relieve your stress or anxiety, like after you've binged watched, you're still feeling the same amount of stress or anxiety, it's not helping you. Isolation, even during this time. We can talk by phone or wave to people, talk to people out of a window. It's really important to connect with others. And avoidance and being by yourself all the time and isolating is really not helpful. And it also can keep us from making necessary appointments or doing necessary important tasks, especially those related to self-care, like doing our PT exercises. And I don't need to mention, but I will, drinking too much, overeating, withdrawal, overusing prescription medications, and even sleeping too much. The other possibility is filling up every minute of the day to avoid feeling or looking at whatever it is that's bothering you. In moving on to instrumental coping, this is coping by finding new strategies. And this is great. It can really help us feel so empowered. Like participating in this program, using adaptive devices, consulting with an expert, asking others how they've dealt with it, looking online to find resources, or learning a new way to do something are all great ways to help us cope with stress and anxiety. And yes, it does have a downside. When it becomes not helpful when you're spending most of your time researching about MS or COVID-19, when you're putting pressure on yourself to find a way to change something that maybe can't be changed, when you're exhausting yourself looking for answers, when you're spending so much time focused on an issue that you're not leaving time for enjoyable activities. So the instrumental coping of strategies to try to help yourself needs to be balanced with some of the avoidant, like having fun or, watching a movie. It's all about the balance. And let's take a look at the third one. So the last one I want to talk about is psychological coping. Coping that by recognizing that you are having a hard time and honoring your feelings. Like going to a good self-help group, talking to someone supportive, seeking psychotherapy, writing about it, crying, and getting angry is also a way of psychological coping that can help. Meditation and prayer. But again, psychological coping has sides to it that are not helpful. If you're spending most days in tears or being angry, or you're spending so much time with the problem that you're not seeking a way to make it easier, if you're hurting yourself, or you're spending so much time with this kind of coping that it becomes avoidance, meaning you're not doing anything to change it. So you can see how it's important to balance out all three of these coping mechanisms and be aware of when they're helping you and when they may not be helping you. So I invite you at another time to really take a look at how you're coping with things and if your coping is working for you. If not, you have the power to make some changes. So moving on to other ways that you can get help with stress and anxiety management. We're going to look at, for a minute or two, the importance of thoughts. Thoughts can hurt and thoughts can also heal. So how you think can have a profound effect on your emotional and physical well-being. Thoughts and beliefs can increase or decrease stress. And the good news, with awareness of our thoughts and willingness to change our critical self-talk, and I think we all know what that is, that voice in our head that says really unkind things to ourselves, really judgmental things to ourselves, things that we would not say to anybody else. That hurts us. We can learn to be kinder to ourselves and make it just a little easier on ourselves, or at least not scare ourselves with unnecessarily painful thoughts. And especially now, those scary thoughts, those what if thoughts, can cause us additional distress. The looking into the future and seeing it very negatively and being so overwhelmed by the fear. You're not in reality, those are your fears, but if you start believing them, that's going to cause you a lot of additional stress. So here's some examples. Thoughts that hurt are absolutes. I will never be able to have fun with my friends again. I will always have a hard time with MS. Nobody likes me now that I have MS. I'll never figure this out. Nobody understands. As you can see, these really are absolutes. They give us no other option and they trap us. So our stress increases, our anxiety increases. But there's positive self-talk, thoughts that help. I can find a way. I can find things to do that are fun. I can connect with friends, even if I'm at home. I am going to figure out how to be easier on myself. MS doesn't need to change the person that I am. And right now I'm not able to do this, or right now I may not be able to do this, but I can find a way to make it easier, decide not to do it, or ask for help. Yes, deciding not to do it or asking for help is difficult for a lot of people, but finding ways to make it easier releases the stress on us. This is the time that I had promised you where you get to have some more experiential opportunities. So I'm going to be talking about actual things that you can do on your own or guided to really help you release stress and anxiety. And they're called mind-body interventions. So we've already talked about the psychological stress that occurs in our mind, producing physiological stress. The opposite is also true, that calming thoughts or images can bring increased relaxation. So mind-body interventions are geared towards helping you use your mind to produce desired physiological reactions such as relaxation, soothing, increased comfort. They're used for pain management. They're well-researched, safe, and effective, and they are a nice complement to medical and psychological interventions. Here's a list of some of them, and I will be giving you an experience with a couple of these here. And you'll also have some references that so you can get some more understanding. And all of these have been utilized to help people out. So the first one I'm going to talk about is just awareness. All mind-body interventions begin with awareness. So people that are uncomfortable in their bodies, it is difficult to pay attention to your body when it doesn't feel good. But we need to pay attention to our bodies in order to help ourselves feel better. So we talked about earlier awareness of how the body responds when there's emotional or physical discomfort. After you've had a stressful thought or a stressful encounter, checking in with your body to see how you've responded can be an immediate way to help you out, so that if you're tightened up, you can loosen up a little bit to help you feel more comfortable. We get to have awareness of how even a small movement, a light or compassionate attention to our thoughts can bring increased comfort. It doesn't have to be dramatic or complicated. And sometimes the simplest mind-body interventions are the most effective. So I'm going to talk about imagery, and after I'm done talking about it, I'm going to give you an experience with it. It's a gentle, powerful approach. It helps with a state of relaxation and focused attention. And guided imagery refers to a wide variety of techniques that can be simple visualizations, but it also could be using drawing or active imagination, or when you close your eyes and listen to music and go someplace else. It can be led by a trained practitioner, or you may just pick it up through a YouTube. So I want to now give you an experience with this, so I'm going to invite you, if you're comfortable enough, to close your eyes for a couple of moments. And if that doesn't feel comfortable for you, just look at maybe a blank wall so that you can allow your imagination to go. And just taking some nice, comfortable breaths. I'm going to invite you to think about water in some form, as is in a shower or a mist or a waterfall. If water doesn't feel comfortable to you, you can change that to cloud or anything that might feel more comfortable. So when imagining water, I want you to see if you can imagine water coming over you. If it feels good, have it start at the top of your head. If not, it can start at your shoulders. Like imagining being in a shower, or being in a mist, or a very gentle waterfall, or a light rain that is just the right temperature. And as you're breathing, and this water is just lightly coming over your body, imagining that it's taking with it all of the stress, just like when we're really dirty and the water washes away all the dirt. Imagine that the water can wash away all of the stress that you're holding in your body, and just breathing with it. And with each breath, imagine that it's just washing away. Now, you may actually see this, or if not, you can just tell yourself this story that I am pretending that I'm in this really nice mist or shower or waterfall, that with each breath out, it's just taking away all of the stress. Now, some of you may want to stay with this, while others may want to get even more creative. And you can imagine that there's a color that's coming over you, a color that you feel is calming, or it may just be your favorite color, or it may be more than one color. So I invite you to just play with this, either imagining the clear water, or the clear cloud, or color coming over you, coming over your body and just filling you up with comfort or relaxation. Or maybe you need a little energy, so maybe it's a brighter color and it's giving a little energy. And just breathing with this. And just a little bit longer, telling yourself that all you want to let go of, all the stress that you might be in your mind, is going away, washing away, and a color that's coming down through your body, filling you up with what you might need. And this, of course, can go on for much, much longer than we have time for. But I just wanted to give you an idea of what you might do. You can even do this in bed at night to let all the tension go before you go to sleep. And cover yourself with something that might help you sleep. And this is just one form of imagery. There's so much more. If you love it, great. If it doesn't work for you, there's plenty more. So I'm going to move on to another one, taking a deep breath. I'm going to invite you to open your eyes again if you wish, or you can just listen as I talk about another potential technique. Somatic experiencing is something that people haven't heard as much about. Developed by Peter Levine, it's now showing great promise as a pain management technique. He originally developed it to help people with trauma. And it draws upon scientific research of the autonomic nervous system, which is that fight-flight response we were talking about. It gives us the ability to self-regulate, to return to comfortable body sensations after having a stressful experience or encountering discomfort. So I'm going to offer an experience with somatic experiencing now. And invite you to keep an open mind and try this one out also. There is always, no matter how uncomfortable or distressed we are, there is always a comfortable place in our body. Always. If we are not having a heart attack, we definitely have a comfortable place in our body. There's some place in our body that's not agitated. So you may not even notice that it's comfortable because it may just be a body part feeling like a body part so that you don't even notice it. Because we tend to notice discomfort. We tend to notice distress. But one of the ways to help ourselves with stress in our minds or distress in our body through discomfort is to find one place that feels comfortable enough. One place in your body that's not calling your attention. So see if you can do that now. And if it's really difficult for you, if you're feeling like there's many places that are not comfortable, then try something like your hair, or sometimes the tip of your nose or the tip of your ears. And see if you can find some place, even if it's a very small place, some place in your body that feels comfortable enough. May not be perfect, but comfortable enough. And then just breathing and seeing if you can focus your mind just on that place. And your mind may pull you into thoughts or pull you to focus on other places in your body. And if it does, gently bring it back to just focusing on this place in your body that is comfortable enough. And just breathing with it. No special breaths. Just teaching your mind to focus on what's comfortable enough. Teaching your mind to focus on a place in your body that may be more relaxed. Giving that overactive mind something to do that feels comfortable. Like focusing on a place in your body that's comfortable enough. And if this is working well for you or well enough, I encourage you to continue with this for the next minute. If it doesn't feel like it's something that you enjoy, this is just one technique of somatic experiencing, and you don't have to continue with it. You can look at something nice while the rest of us focus on a place in our body that is comfortable enough. Knowing that even if your entire body feels like it's uncomfortable, your entire body is feeling stress, there's always a place that's comfortable enough. And it's really helpful to our brain to know here's a place that's comfortable enough. So we know that we're okay. By allowing our brain to focus on something that's comfortable enough, We disengage that fight-flight mode, and we bring ourselves back to neutral. May not be great comfort, but we can bring ourselves back to neutral. We can get ourselves out of the fight-flight mode. And just once again, noticing that place in your body that's comfortable enough. And I invite you in the future to help your mind learn to focus on places that feel comfortable. If we can't stop our mind from racing, if we can't stop thinking about what's causing us anxiety, we can always go into our bodies and find a place that's comfortable enough so our brain can be aware that we're okay. And then the rest of the body can begin to disengage from the fight-flight mode. And just taking a breath, we're going to move on to one more possibility for you. Another possibility is mindfulness. And we'll talk in a minute about a type of mindfulness, but mindfulness is paying light attention or soft attention to your thoughts or your body. The central element of mindfulness is to remain present in the current moment and practice non-judgmental acceptance. And it can be a part of sitting quietly for 5 to 30 minutes, focusing on the breath and letting go of thoughts. So right now, we're going to do this for just a couple of minutes. Again, to give you an idea of what it might feel like and see if mindfulness might be something that you can be interested in. And before I do that, I want to talk about a type of mindfulness that many people know about. And it's mindfulness-based stress reduction, which was developed by Dr. John Kabat-Zinn. And it's been utilized in hospitals, it's been utilized in medical centers, and in many other places in groups that people are finding it quite helpful. And you can find resources for mindfulness-based stress reduction in many different places. So let's take a moment to experience a bit of mindfulness. And some of you may know a lot about this, and others, this may be brand new. So again, I invite you to close your eyes or look at something and we talked about light attention. Just notice what's in your mind, what your mind is thinking right now. And breathing and being aware of what your mind is thinking. And see if you can be aware of this without having any judgment, completely accepting it. Completely accepting where you are right now, whatever you're experiencing, whether you're enjoying this or not enjoying this, having complete acceptance for it. Because when we struggle against something, we cause ourselves additional stress. So mindfulness invites us to fully accept where we are at that moment. And as you notice the thoughts and you allow yourself to breathe with full acceptance, see if it's possible for you to then just focus on the breath. Now, some people like to focus by counting. So in breath, 1, 2, 3, 4, 5. Out breath, 1, 2, 3, 4, 5. Others like to just focus on the breath. See if you can allow yourself to be totally present in the moment. As thoughts come in, fully accepting them and coming back to the breath. Using the counting if you wish. In 2, 3, 4, 5. Out 2, 3, 4, 5. Or just breathing without counting. Again, recognizing that your mind might want to pull your attention. We do love to pay attention to our thoughts. Accepting the thought and coming back to the breath. And your body may want to pull you in. You may notice some place in your body that's not that comfortable. And that may want to call your attention. Recognize it, and then come back to your breath. So that you learn that you can sit in acceptance. Acceptance doesn't mean that you're happy about it. It doesn't mean you would like it. It just means this is reality and this is what's here right now in your life, in your mind, in your body. And stress reduction is allowing yourself to not fight against it, to just breathe, or some people say to breathe through it. And for just another moment, just breathing in and breathing out, paying light attention to any thoughts or body sensations, not overemphasizing any of them, and giving yourself permission to come back to the breath. Noticing that you might completely accept this and relax into it, or you may be struggling against it. No matter what you're experiencing, just allow yourself to accept it and breathe with it. And now again, following my voice back to this presentation, opening your eyes if they've been closed. And we're going to move on to the next slide. So we're coming to our end. You've had the opportunity, and you will now have more of an opportunity to consider which stress management techniques you'd like to continue to use or learn more about. This is an overview. Every technique that I showed you, I did very quickly. They often go for 10 minutes or 15 minutes. And there's so much more of these for you to explore. You may choose one of these techniques just because you like it. You may find a technique that you really like elsewhere and give yourself time to explore, as well as thinking about the different types of coping and the different stress busters, and realizing that there is so much available to help you right now. You don't have to be struggling, and you certainly don't have to be struggling on your own. There will be some references included here, but you may want to find some additional information, and there's some YouTubes available also on some of these techniques. This is going to be the end of the program. I invite all of you to be kind to yourself, to think about, can I do this differently? Can I find ways to make this easier on myself? and to use whatever in this program works for you. And if it doesn't work, you don't have to worry about it. Thank you. Thank you for joining me, and I wish you well.